Hey guys, all right, I feel a little bit like I'm running the bloopers reel here. So anyway, today is May 1st. It is Celiac Awareness Month. And just as I tried to go live a few minutes ago, my dog decided it was time to start wandering around in my little studio area. So had to kind of stop, regroup, and start back again. So anyway, today is May 1st. It is Celiac Awareness Month. And when I thought about ways to be able to bring value to you guys, one of the things that really hit me is the last couple of years I try to do posts during Celiac Awareness Month, hey Mark, and during Celiac Awareness Month, just sharing a little bit about what celiac disease is and just a lot of the education for those either that have celiac, are newly diagnosed with celiac, maybe have gluten intolerance, or you care about or love somebody who has celiac or gluten intolerance. So when I thought through that, one of the things that I thought about was doing some go lives. And I'm a certified health and wellness coach. I run two blogs or two websites. One of them is my individual health and wellness coaching website, healthyhappymomsy.com. And the other one is just kind of a result of a lot of people have come to me since I was diagnosed with celiac, which was 10 years ago now, and asked for help, whether it's been that they've been diagnosed, somebody that they love has been diagnosed, they're trying to navigate this new gluten-free world. And my daughter also has issues with gluten. We're not positive if it's celiac or gluten intolerance. My now ex-husband and I decided 10 years ago, based on the data that we had available, that we would just have to assume that it was celiac. So here I am, a mom who has celiac, and my daughter has presumed celiac at this point. So what have I learned in 10 years? I've learned a ton. And on my E&Me G-Free website, which is the one that kind of resulted in being able to pull everything together for what I've learned, what I want to share with people, I wanted that to be separate from my Healthy Happy Momsy website, just so that if somebody's going for information on gluten, on celiac, that kind of thing, they have somewhere specific to go. So I also run a group on Facebook called Positive Celiac and Gluten-Free Support. So if you're looking for a Facebook group that is monitored for making sure that the posts are positive and uplifting and a supportive environment, then I run that group. There are several groups out there that are amazing, and I'll talk a little bit more about that. But anyway, when I sat down this morning and prayed about it and then meditated about what I wanted to do, what I wanted to bring you guys for value, stuff just came rolling off. And it was just from lots of things that I see posted within my group, within other groups, where there's just so many questions and things that would help people to understand more about celiac and about gluten issues. So I just quickly wrote down some different categories, and I'm not going to try to cover everything today. I'll give you a little bit of a hint as far as a few things that I'm going to be covering, so I won't try to read everything to you, because even today's post is just going to be focused on what is celiac. I'll talk about non-celiac gluten sensitivity actually tomorrow, and then also talk about the whole gluten-free diet concept, because that's a whole different thing. Talking about trying to understand the differences between allergies and autoimmune disorders, understanding the repercussions and the importance of sticking to the program. I don't want to say diet, because it's not a diet. A diet, although, is the way that you eat, what you eat, the program. And just different tips about, how to handle it when you're first diagnosed or when you're first going gluten-free, because it can be super overwhelming. How do you deal with different things like large gatherings, going out with friends, holidays, things like that? I promise you don't have to give everything up. There's a gluten-free option for pretty much everything out there. I even found out that there's a gluten-free option for funnel cake. Blew my mind. That's on that list of things I want to do this summer, is to travel around the country and check that out. But when you get diagnosed with celiac, or when you go gluten-free, can look different depending on what age you are. So whether it's kids going through it, teens, adults, and then also, like, where do you find the resources, and how do you handle this new expensive type of diet? And there's ways to work through this, I promise. So that's just a few of those things that I'm working on. And then also, I have a list of some people that I want to contact that I'm working on. A few of them I already have reached out to, but who I can do interviews with to bring you guys, once again, more information. But I have tons of content. I'm not going to try to throw it all at you in one post, because I think that'd be, like I said, way too much. But if you have certain topics within celiac gluten-free that you want me to talk about, that you want more information on, please comment below. I am definitely flexible with what the topics are. Maybe I can combine some other topics and address something if you bring something up that I have not yet thought about. So I pulled up and looked at the Celiac Disease Foundation website as well as the Mayo Clinic for explaining what celiac is. And I think it's a very misunderstood diagnosis because celiac, when we go out to eat, we might explain it as an allergy, but it's not an allergy. It is actually an autoimmune response. And so because of the fact that, somebody's just, all they wanted to do was just take our order. They don't usually want a full medical diagnosis and all of that. Sometimes it's just easier to say when you go out to eat, it's an allergy, because then they'll take the proper precautions for things not touching. So celiac disease is an autoimmune disorder. Depending on what part of the world that you live in, it might be called celiac sprue or gluten-sensitive enteropathy. And celiac is also different or spelled differently depending on where you are. And yes, I'm completely cheating off my little phone here because I pulled this up. So celiac disease is an autoimmune response in reaction to the ingestion of gluten, rye, or barley. For some people, oats are also included in that, but we won't even get into that right now. But what happens when a person with celiac actually ingests gluten is that in their small intestines, the lining gets impacted and it prevents absorption of some nutrients. So that happens with the villi in your small intestine. So we'll talk a little bit about some of the symptoms and diagnosis because it's different depending on the person. But the malabsorption within the intestinal damage, or the malabsorption happens as a result of the intestinal damage. And it can often cause diarrhea, which is like the number one thing that people think of when they think of celiac. Fatigue, weight loss, bloating, and anemia. And the other issue is that it's not just those symptoms. It's not just those problems. It can also lead to long-term complications, which is why it's important to address this versus, I think a lot of people will brush this under the rug, and I think that's part of the issue because we're talking about a digestion problem, or where it's most easily recognized is in a digestion problem. And people, when they have babies, they're usually comfortable talking about digestion. That's, it's okay to talk about how the baby has bowel movements or does or doesn't. And then elderly people are more comfortable talking about the digestion system. But everything in between, it's kind of become taboo to have those discussions. And because of that, I think that's a big part of why people don't realize a lot of the way that our bodies are functioning isn't normal. So anyway, symptoms can differ depending on the age and depending on the individual. And so it talks about that the signs and symptoms of celiac can vary greatly, and especially they're different between children and adults. So the most common, like I said, were diarrhea, fatigue, and weight loss. But adults can also experience bloating and gas, abdominal pain, nausea, constipation, and vomiting. So you've got a disease that most commonly presents as diarrhea, but can also present as constipation, which a lot of people, just with the way our dietary system is, they're going to have those issues. But more than half of adults with celiac actually have signs and symptoms that are not related to the digestive system. So that's the other part of it. That's why I say it's an autoimmune disorder, because it's not just impacting your digestion. It's most commonly showing up in your digestion. But because of the fact that it can present in so many different individuals and patients, not as a digestive issue, that's where it gets complicated. So what are some of the symptoms or presentations that it might show up as? Anemia, usually resulting from iron deficiency. Again, if your villi are damaged and your body cannot absorb enough iron, there's that as an issue. Loss of bone density, osteoporosis, or the softening of bone, which is called osteomalacia. Osteoporosis is definitely a prevalent condition in America. Getting shorter as you get older, by the way, is not normal. Just something to share. Damage to dental enamel, mouth ulcers, headaches and fatigue, nervous system injury, including numbness and tingling in the feet and hands, possible problems with balance, and cognitive impairment. Joint pain, reduced function of the spleen, or acid reflux and heartburn, which I've definitely heard of a lot of people getting diagnosed when they're experiencing acid reflux and heartburn. Children can also have different symptoms that they present with. So children under 2 years old, typical signs and symptoms of celiac disease include vomiting, chronic diarrhea, swollen belly, failure to thrive, poor appetite, and muscle wasting. I'll get into my story on another day, but I'm going to say my daughter did not present with what they are considering the classic signs of celiac. Older children may experience diarrhea, constipation, weight loss, irritability, short stature, delayed puberty, and neurological symptoms, including attention deficit disorder, hyperactive disorder, learning disabilities, headaches, lack of muscle coordination, and seizures, otherwise known as epilepsy. This is something that has been very interesting because I cross-referenced a couple of different websites that are well-known and respected for looking at what these symptoms are, how they present themselves, and how they're different. And there was a lot of similarities between these websites. So I think that was super important to note. One other thing that it talks about as far as how celiac presents itself is something called dermatitis herpetiformis. And this is one of those things that it's, again, there's a lot of things when it comes to different diseases that are just not pretty to discuss. And dermatitis herpetiformis is actually something that I had dealt with, had no clue that it had anything to do with what I was eating. But it's actually also known as the celiac rash. And it looks like the herpetiformis, the way that it actually presents as far as the little blisters, that's related to celiac. So it does have to be diagnosed through a biopsy. It has to be medically diagnosed. You can't just say, oh, I've got a rash, that's the celiac rash. So celiac is something that does need to be diagnosed by a medical professional. And I will actually get into that a little bit later because one thing that I've noticed is that when I was a pharma rep for 17 years, traditional primary care physicians aren't as familiar with celiac. And even sometimes the specialists, dermatologists, gastroenterologists are still not as educated on celiac because it's one of those kind of newer diagnoses in many areas. Let's see. It does talk about the prevalence of it. So celiac disease, the overall presence is 1 in 100. However, if you have a first-degree relative, then your chances are more like 1 in 10. Risk factors for celiac disease, because it can affect anyone. However, it tends to be more common in people who have, like I said, a family member with celiac disease or dermatitis herpetiformis, which is kind of back and forth as to some people say dermatitis herpetiformis is the celiac rash. There's kind of controversy, it is a type of celiac. It is celiac. Type 1 diabetes, Down syndrome or Turner syndrome. That, to me, I didn't realize. Autoimmune thyroid disease, microscopic colitis, lymphocytic or collagenous colitis, Addison's disease, rheumatoid arthritis. Some of the complications that can happen with untreated celiac disease would be malnutrition, loss of calcium and bone density, infertility, and miscarriage. Lactose intolerance, because you've got some of the damage, this is damage to your small intestine, may cause you to experience abdominal pain and diarrhea after eating lactose-containing dairy products, even though they don't contain gluten. Once your intestine has healed, you may be able to tolerate dairy products again. However, some people continue to experience lactose intolerance despite successful management of celiac disease. And I will say that there are, in several of the groups that I'm in on Facebook, that they do talk about, there's a lot of people that have other foods that their bodies can't properly digest. So it's very common. Cancer, people with celiac disease who don't maintain a gluten-free life have a greater risk of developing several forms of cancer, including intestinal lymphoma and small bowel cancer. And then neurological problems, like I said before, some people with celiac disease may develop neurological problems such as seizures or peripheral neuropathy. So it's definitely, it sounds like, oh my gosh, there's all this stuff going on. But one of the things to be aware of, like I said, it is an autoimmune disorder or an autoimmune disease. And so when you have one autoimmune disease, and it depends on the age of onset, the older you are when it's diagnosed, the more likely you are actually to have other autoimmune diseases that come along with it. So that's today's lesson on celiac awareness, or for Celiac Awareness Month. Like I said, tomorrow I'll get into the difference between celiac versus non-celiac gluten sensitivity. The treatment for celiac is very simple, and it's It's simple, yet it's complicated. The treatment for celiac is a gluten-free lifestyle. I'll talk a little bit more about the cheating and why you can't cheat in another installment here. But you go through diagnosis, which we'll talk about, but the treatment for it is a gluten-free lifestyle. There's no changing on that. There's no medication for it at this point. They are doing a lot more research into it. They're looking into some different options, but there is no medication that actually stops celiac. If a person ingests gluten, then they will sometimes have a reaction, sometimes they won't. It depends on the person. So we'll talk more about that in the next month, but I'm excited. Thank you guys so much for tuning in. If you have other questions specific to celiac or gluten, gluten intolerance, please post them in the comments, and I appreciate it. Have a wonderful day. Thanks for tuning in.